Today we have a very special guest, Dr. Michele James.
Hi.
She is a veterinary neurology specialist.
Yeah.
So if you want to just start with your journey to becoming a veterinary neurology specialist.
The process to specialize, you go to 4 years of veterinary school, and then after veterinary school, you do an internship, and then sometimes you'll end up doing a specialty internship, which I did in Canada, which is where I met Dr. Lopez. I did my neurology internship at Canada West in Vancouver. And then you do a 3-year residency, which I did down at University of Florida. And then you take boards. And then after that, you get all the letters behind your name and you become a specialist.
Such a long journey, so much hard work.
Yeah, it is. It's a lot of work, a lot of very long hours, and you do it because you love it, not for income. But in the end, you get to do something that you really love, which I really love neurology, so it works out really nice.
What kind of cases do you mostly see?
The cases I get to see, for the most part, have neurologic disease. In my residency, I would see a variety of large animal and exotics and some zoo animals too.
With neurologic disease?
Yeah, I did. Yeah, I worked with a lot of exotic species down at Florida. But here up in Boston, I'm mainly seeing client-owned pets, so dogs and cats. Sometimes we'll see pocket pets like rabbits, some birds, and a few reptiles. And a majority of my patients have neurologic disease. Sometimes they present with signs that we think are neurologic disease, but aren't necessarily. But a large majority have neurologic disease. So pets that have seizure activity, animals that have difficulty walking, that might have disc herniations or fractures or tumors, and then some animals that have neuromuscular disease. So their muscles and nerves aren't communicating well and they have weakness. So that's the majority of cases that I see.
So interesting. I've always found your specialty to be extremely busy, one of the busiest services, and be just so interesting, all of the different testing that you have access to.
It's really exciting. It's a mix of emergency medicine, surgery, and medicine. So a nice mix of everything.
It's always really cool to see all the miracles that you guys were pulling off on all of the neuro patients. I remember when we were working together, you guys had this cat patient that had like 9 lives, and your team, Dr. Sharp and everybody, they had removed a brain tumor from him. Do you remember the orange cat?
Yes.
He was famous. I don't know why I can't remember his name right now, but he was just the greatest.
Yeah.
But I was so impressed.
I actually think he had 2 brain surgeries.
Yeah.
I think that cat did. They can do really well. And I think that's probably another thing too, is, neurologic disease can be really, really scary in people and in animals. But there are a lot of things we can do to help. And so, just because a pet has a neurologic disease doesn't mean we have to give up. It depends what they have and what our options are, but it's definitely something where, as scary as it is, there's a lot that we can do to help our pets nowadays. So definitely worth following up with a vet.
I mean, you guys are heroes. I've seen so many patients that were literally either paralyzed or on death's door from things like meningitis or brain tumors or all kinds of things. And then days or weeks later, they're walking out their front door like nothing happened, going home to live a happy life with their family. But that kind of care is not free.
Nope.
From 99% of people, it's completely out of reach if you don't have medical insurance. So if that's the kind of care that you would want for your pet, for them to receive, the same kind of care that a child would have, then, you kind of need to think ahead before you get into one of those scary situations. Are there any breeds that tend to be kind of overrepresented in the neurology service that maybe people should know about if they have those breeds?
The most common breeds I would say that we see are French Bulldogs and Dachshunds. And I would honestly say French Bulldogs might be the most popular. Now, granted, I practice in Boston, which is a city. And so French Bulldogs are, a great breed in the sense they're small dogs. People live in apartments or townhomes, and they're great companions. But unfortunately, they are predisposed to disc disease, so slip disc herniations. We also can see them as they get older, brain tumors and inflammatory brain disease, but we see them quite a bit for disc disease. So I would say that's probably the most common breed we're seeing now in the last 5 years I've been here. Dachshunds and French Bulldogs being number 1. And then for large breeds, we see a lot of German Shepherds, Great Danes, some working dogs.
Interesting. Is your caseload, would you say, mostly back surgeries, like patients with disc disease?
Yeah, I would say disc disease is probably maybe about 60 to 70%, maybe 60% of what we see. We see a lot of animals for seizures.
anything, any last advice that you'd like to share with people, or 2 cents?
I think the best thing is to make sure that you're getting annual exams through your local vet. Preventative care is really good now in veterinary medicine, and that's why our pets are living a lot longer. So making sure you go to your annual exams so that your local vet can pick up on any concerns they have that might need additional follow-up through a specialist. And then if you do have, immediate concerns and your local vet's not there or available because they're closed, definitely utilize our emergency clinics. That's what they're there for. And we can really prevent or at least stop cases from being really severe from a neuro perspective. So even for our seizure patients, we say if your pet's having a lot of seizures, don't drive an hour and a half to come see me. Go to your closest emergency clinic so your pet can be stabilized, and then they can always consult with me. So
Yeah, once they're stable.
Yeah. So making sure that you get care as soon as you can. If we sit on things, that's when we get to have a lot of problems that we could deal with earlier.
Okay, well, thank you so much.